The pilot implementation of the Alert Level 4 in Metro Manila set to lapse tomorrow, September 30th. What should the next quarantine classification be for the capital region? Joining us now is Professor Guido David from the OCTA Research Group. Good morning, Professor. Good to talk to you again. Now, we've seen 2 straight days of cases below the 20,000 mark. Can you explain to us the reason behind this trend? And is it really a trend? Is it reflective of the number of cases we have out there? Can we say na talagang pababa ng mga kaso sa Metro Manila and in the provinces?
Yes. Hi, good morning, Ria. Yes, this is definitely a trend in the entire country because what we're seeing is that the reproduction number in the NCR has decreased to less than 1. It's actually around 0.94. And it's not just in the NCR, but also in Calabarzon and Central Luzon, where the reproduction number has actually decreased to less than 1. That includes Cavite, Laguna, Batangas, Bulacan, etc. So the trend is definitely going down in these regions, and of course in Cebu City, in Cebu area, it's going down. There are some provinces where the trend is still increasing, and we should really take note of these provinces because these are areas of concern that we should be focusing on, and probably we need to allocate more vaccines to those regions. So that's sort of giving a slight pushback, but overall the trend in the country is decreasing the reproduction number. I think it's 0.97 in the entire country. And that's because the NCR plus is driving down the number of cases overall.
All right. Well, that is definitely good news. And with this in mind, do you think that it's safe to downgrade the quarantine classification in NCR? What is your personal suggestion, and how long would you recommend this new alert level classification for?
Well, actually, Ria, we're not really familiar with the alert level system. So what our understanding is that of course, the IATF and the Department of Health determines the alert level systems for the regions, for the LGs. And our understanding is that it's based on daily attack rates, based on healthcare utilization. Since we're not familiar with it, we actually can't determine what is the corresponding alert level. What I can say is that based on the indicators, healthcare utilization is still at high level right now in the NCR. Even though cases are decreasing, it will take some time before healthcare utilization, before hospital beds ease up. It may be around at least 2 weeks before, or 2 or 3 weeks before we see a decrease in the number of hospital beds occupied in the NCR, especially ICUs. And also, the daily attack rate is still at a critical level based on COVID Act now. Now, that will change very quickly if the downward trend continues. We may be at high level in a matter of 1 to 2 weeks, and that would be very good news. It could have effects or a corresponding alert level that may reflect that. So we'll have to see what the IATF determines, but what we're saying right now is that healthcare utilization is still at high risk at the moment.
Professor, to what can we attribute this downward trend? And based on your data, will we continue to see a lower number of cases?
There are several possible explanations, Ria, and I've actually offered those explanations in the past. One is that the MECQ, the lockdown, did have an effect. The downward trend started to happen around September 11 when we were still under MECQ. But we could say that the alert level system has proven to be effective thus far. We haven't seen a spike in cases while the alert level system has been implemented. So we can say that it's effective so far. Secondly, we believe that people are more compliant right now in following protocols, and that's because of the threat of the Delta variant. There's news all over the world about the Delta variant, and people are more informed, more aware of the Delta variant. And third, the vaccinations that have been ramped up, especially in the NCR, based on latest data that I've seen, nearly 7 million people have been fully vaccinated in the NCR. That's about half of the entire NCR population, and that will definitely have an effect on controlling the number of cases. There's another possible factor, and it was actually published in the New York Times, and we have been observing this pattern for some time now in other countries, in the Philippines, that each variant seems to have a seasonality factor in that a wave usually lasts about 2 to 3 months. And that's giving us optimism that the Delta wave in the NCR plus will soon come to a close, and that's what we're calling the end game. When that happens, we're not there yet, but we're seeing that it's starting to happen.
Yeah, we certainly hope that is the case. Thank you always for your time, OCTA Research Fellow Guido David.